Welcome to this YouTube channel. In this video we are going to talk about reverse diabetes in a natural way. So before starting this video, like this video, and subscribe to our YouTube channel for future updates. When the blood sugar levels are elevated than average, but not high enough to be diagnosed with type 2 diabetes, you have prediabetes. It's unclear what causes prediabetes, but it's linked to insulin resistance. When your cells stop reacting to the hormone insulin, you've reached this point. Insulin is produced by the pancreas and allows sugar, glucose, to reach the cells. Sugar will build up in your bloodstream if your body doesn't use insulin properly. Although some people experience darkening of the skin around the armpits, abdomen, and elbows, prediabetes does not necessarily cause symptoms. Prediabetes may be diagnosed by a simple blood examination. A fasting plasma glucose (FPG) test is part of this. Prediabetes can be detected with a result of 100 to 125. An A1C test, which tracks your blood sugar for 3 months, can also be used by your doctor. Prediabetes can also be detected by test results ranging from 5.7 to 6.4%. A diagnosis of prediabetes, on the other hand, does not guarantee that you will have type 2 diabetes. By changing their diet and lifestyle, some people have been able to cure prediabetes. Number 1. Eat a clean diet. A diet rich in refined foods, which have added fats, calories, and sugar with little nutritional value, is one risk factor for prediabetes. Your chance is also increased if you consume a lot of red meat. A clean diet, which consists of nutritious options, will assist in the restoration of natural blood sugar levels. Prediabetes can be reversed, and type 2 diabetes can be avoided. Make low-fat and low-calorie diets a part of your diet. There are a few examples: fruits with complex carbohydrates, vegetables, lean proteins, whole grains, and healthier fats such as avocado and fish are all good choices. Number 2. Exercise regularly. Another risk factor for prediabetes is insufficient physical exercise. Not only is exercise good for your energy and mental health, but it will also help you lose weight by improving your insulin sensitivity. This increases the efficiency with which your body's cells use insulin. Exercise can lower blood sugar levels for up to 24 hours after a workout, according to the American Diabetes Association, ADA. If you're starting a new workout regimen, take it slowly at first. Start with 15 or 20 minutes of moderate physical exercise, and progressively improve the strength and duration of your workouts after a few days. At the very least 5 days a week, you can engage in 30 to 60 minutes of moderate physical activity. The following are examples of possible exercises: roaming, biking, jogging, diving, aerobics, and sports participation are all good ways to stay in shape. Number 3. Lose excess weight. A daily workout regimen has the added advantage of assisting you in losing weight. In reality, losing only 5 to 10% of your body fat will help you increase your blood sugar levels and reverse prediabetes. This can be anywhere from 10 to 20 pounds for some individuals. Insulin resistance often rises with a greater waist circumference. For women, this means 35 inches or more, and for men, it means 40 inches or more. Losing weight requires both a healthy diet and a consistent workout schedule. Other options are also available. Getting a gym card, meeting with a personal trainer, or finding an accountability partner, such as a friend or family member, are both examples of this. In addition, rather than 3 main meals, it might be beneficial to consume 5 to 6 smaller meals during the day. Number 4. Stop smoking. Many people are aware that smoking raises their chances of developing heart disease or lung cancer. Smoking, on the other hand, increases the risk of insulin resistance, prediabetes, and type 2 diabetes. You will get assistance in quitting smoke. Nicotine patches or nicotine gum are available over the counter. Alternatively, consult your doctor about smoke prevention treatments or prescription medications to help you overcome your nicotine addiction. Number 5. Eat fewer carbs. And if you follow a balanced food plan, it's important to choose your carbohydrates carefully. To further cure prediabetes, you'll probably want to cut down on those carbs. You should consume complex carbohydrates, which are unprocessed carbohydrates, for the most part. There are a few examples: nuts, beans, 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 beans. These carbohydrates are high in fiber, which help you stay fuller much longer. They also take longer to break down, resulting in a higher absorption rate into the bloodstream. This keeps blood sugar levels from rising too high. Simple carbohydrates, which absorb rapidly and cause an immediate spike in blood sugar, should be avoided or restricted. The following are examples of simple carbohydrates: candy, yogurt, butter, juices, and certain fruits are all examples of foods that are high in sugar. Refined carbohydrates are therefore fast-acting, and can be consumed in moderation or stopped altogether. There are a few examples: white rice, white bread, pizza dough, morning cereals, pastries, and pasta are all examples of white rice. Number 6. Treat sleep apnea. It's also worth noting that sleep apnea has been linked to insulin resistance. Breathing slows often during the night due to the relaxing of the throat muscles in this state. Sleep apnea can be detected by looking for the following signs: snoring loudly, gasping for air while sleeping, choking while sleeping, waking up with a fever, sleepiness throughout the day. The most common treatment includes sleeping with an oral appliance to hold the throat open. A continuous positive airway pressure (CPAP) machine is also an option. Throughout the night, this holds the upper airway passage free. Number 7. Drink more water. Another great way to help cure prediabetes and avoid type 2 diabetes is to drink plenty of water. Water is a safe substitute for sodas and fruit juices, because it helps regulate blood glucose levels. Sugar content is normally high in these drinks. Number 8. Work with a dietitian nutritionist. It's difficult to know what to eat when you have prediabetes. And if the doctor makes nutritional recommendations, it's a good idea to get the advice of a licensed dietitian nutritionist, RDN. An RDN will give you dietary tips and tell you which foods to consume and which ones to stop. They will assist you with creating a meal schedule that is tailored to your needs, as well as provide you with other helpful dietary tips. The aim is to get your blood sugar levels back to normal. We value your right to privacy. If you have prediabetes, will antidepressants support you? Even though lifestyle modifications can help certain people cure prediabetes, they aren't enough for everybody. Your doctor can prescribe medicine if your blood sugar levels don't improve, and you're at high risk of developing diabetes. Metformin, glucophage, Fortamet, or a related medication may help reduce blood sugar levels and reverse prediabetes. Metformin has been shown to lower the risk of diabetes by as much as 30%. Trusted source. It could even help you lose weight by suppressing your appetite. When do you see a physician? Diabetes type 2 may develop from pre-diabetes. As a result, it's important to keep track of your symptoms, and consult your doctor if you notice any early symptoms of diabetes. These symptoms may differ from one person to the next, but they may include increased urination, unusual appetite, poor vision, nausea, and thirst are all symptoms of increased urination. Now we'll go through some herbal treatments for spontaneously treating diabetes. Number 1. Apple cider vinegar. Acetic acid is the main component of ACV, and is said to be responsible for all of its health benefits. ACV may be used in a variety of ways, many of which are based on scientific data. 2 teaspoons taken before bedtime will help lower the fasting sugar levels in the morning. And better, taking 1 to 2 teaspoons of ACV with meals will lower the glycemic index of a carbohydrate-heavy meal. I usually advise patients to take ACV on its own before a meal, or to incorporate it into salad dressings or teas. Number 2. Fiber and barley. Blood sugar and insulin levels are reduced as fiber is consumed. Fiber use should be about 30 grams a day. The average American consumes between 6 to 8 grams, which is insufficient. Although fiber supplements such as Metamucil, psyllium husk, are available, the best way to achieve your target is to eat your vegetables. Barley is a high-fiber, high-protein grain with plenty of evidence to back up its role in lowering blood sugar, insulin, cholesterol, and inflammation in general. Barley does not need soaking and can be cooked on the stovetop in less than 15 minutes with only water and salt. Number 3. Chromium. Chromium deficiency impairs glucose metabolism and is primarily present in brewer's yeast. The benefits of chromium for lowering blood sugar and A1C levels are well documented. This supplement should be used with caution if you have kidney disease. Number 4. Zinc. Diabetes patients are often found to be zinc deficient. Zinc supplementation has been shown in studies to lower blood sugar and A1C, as well as have an antioxidant benefit, lower blood sugar, and even help cure some of the problems associated with diabetes. Large doses of zinc will prevent other minerals, such as copper, from being absorbed, so make sure to contact the doctor for the proper dosage. Number 5. Aloe Vera. Aloe vera sap is known for its laxative properties. As a result, ensure that you get the gel's juice. The use of the gel, which is the mucilaginous substance within the leaves, is becoming more common. To stop ending up in the shower, make sure any food you purchase is free of aloin and anthraquinones. Number 6. Berberine. This is one of my favorite botanicals, and can be present in golden seal, barberry, Oregon grapefruit, and coptis, among other species. Its use for lowering blood sugar and HbA1c levels is supported by current evidence. This herb can interfere with the metabolism of conventional pharmaceuticals, and it should never be used when pregnant. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.